going and actually evolving into this sort of more access to patient records is definitely going to improve patient care. And you know what? We're all going away from dispensing because government now doesn't want pharmacists to do that. They've cut off funding hugely. So where else can we actually tap into new resources? That's I believe is more services than community pharmacy and clinical services. And I think having these systems like this is the step forward.
I've been really excited working with Jignesh in terms of sharing our medical records, and I've found that the care for the patients at the project surgery has really improved. It's really aided communication, really helped patients, and really helped my time as a single-handed GP, where I can concentrate on doing other pieces of work and know that I've got my pharmacist safely looking after patients and monitoring them as I've prescribed the medications. Before talking to Jignesh and really working out what he was able to see, I hadn't realised that most of our pharmacy colleagues cannot view much of the medical records at all. I think that's really unsafe, and I've been surprised at how many IT obstacles Jignesh has had to face in terms of getting approval to view the shared care records. In my view, our community pharmacists are an essential part of our primary healthcare team, just as our district nurses are or our CPNs are.
Let's say a diabetic and they're actually getting side effects from medications and their sugars are still very high and they're getting symptoms of hypoglycemia. I could probably quickly do a blood glucose test or a blood pressure test, feed it back straight in the system, feed them into an appointment. Okay, and if I'm actually a prescriber, if I'm actually a diabetic prescriber, I can probably up titrate medication and then say, go back to your GP in 2 days' time. I can do that for asthma, certainly. So if someone's got an acute attack of asthma, I can get them steroids, I can actually up the brown inhalers, okay, and then put that into the record and then quickly book an appointment with the GP to have to get that reviewed. So that prevents unnecessary appointments with GPs, patients seen by a clinician at the time that they need to be seen, and actually preventing people going to A&E with complications of conditions. This actually gives you information about what things that you can actually get in a workflow in terms of EMIS Web. So you could get a full summary, a medication record. If I had access to consultations, then you could also probably see full consultations, investigations. So at the moment we're booking appointments for my own patients, but we are looking at cross-booking. So if I see slots, if there's an emergency that I think the patient needs to be seen by a GP straight away, pick up the slots and then actually book into those slots. Similarly, the doctor will be able to do things for their patients. So if they think that I need to have a review done with a patient, if I've got a slot, they can put in a review or an minor ailments or whatever.
And Jignesh is branching out to other areas now as well, so he's helping us with a lot of our long-term condition management. If a patient's popped in, he'll do the blood pressure check. It saves a duplication of work where I can see the records, he can see the records. He's able to prescribe ACE inhibitors safely because he's got the EGFR reading, and I think it just makes for safe working for pharmacists as well. As I say, makes the patient journey so much easier rather than being signposted to the GP who may not have an appointment on the day, and it just makes it much longer for the patient to get safe care at the time they need it. In an ideal world, I would hope that every single community pharmacist in the country had this, to have one shared care record for one patient, so that we were all able to connect and treat our patients safely. It's one journey, it's one NHS, and I think it's a real shame that in 2018 we have the provision and the IT know-how, but we're still a little bit behind in that connectivity, which is essential for safe patient care.